Okay, Mr. Peterson, there was a few things that I did want to go over with you before I did head out for the end of my shift. So, well, I wanted to start off with talking about your pain. Now, I know that we did administer some acetaminophen to kind of help reduce that pain that you are experiencing, but I did want to go over a few ways to kind of help decrease that pain and discomfort on your own and when you go home, and so you don't have to feel the need to kind of take pain medications all the time. It's just another alternative that we like to use. It's called guided imagery. So it's really simple. You just picture your favorite place, say it's the beach or say it's Italy, anywhere that you really love to go that kind of just makes you really happy. If you just close your eyes and picture yourself there, it helps kind of distract your mind and put your mind on somewhere that makes you happy instead of focusing on the pain. So if you could just close your eyes and picture your favorite place, even when you go home, this will really help too. It's something that you can do on your own anywhere. It just helps take that discomfort away. Also, you do have a lot of secretions that are building up in your lungs, so it's really, really important to kind of reduce some of that discomfort of having that build up in your lungs is to cough and deep breathe. This is not only going to help get some of those secretions out of your lungs, it's going to help you breathe a little bit more easier, and it's just not going to be as uncomfortable when you have all of that in your lungs. Also, I did want to speak to you about your lisinopril. So your lisinopril is the medication that you're taking currently for your high blood pressure. It's really, really important that we stay compliant with your medications. This is going to help decrease your blood pressure and kind of take some of that workload off of your heart as well. So we need to have a schedule that we are taking our blood pressure medications every day. And what I find more useful or helpful, I should say, with taking multiple medications is using a medication box. This is going to help properly plan out your week and what medications and when you have to take them. So can you tell me next time that you are at the pharmacy or at Walmart, something that you should look for that's going to help you stay on track of taking your medications? Yep, the medication box. Perfect. Okay, another thing that I did want to talk to you about is the incentive spirometer. Now this thing looks a little weird, but it's sitting on your side table, and it's really, really important that we do use this consecutively throughout the day. This is going to help expand the alveoli in your lungs, and it's going to help you breathe a little bit better. So what you do is you want to take a deep breath, and then you want to let out, and then your next inhale, as you breathe in and inhale, you want to inhale as long as you can hold it. And so this little meter is going to go up, and we want to keep getting that up. So it's going to help kind of expand that alveoli, and in the end it will help you breathe a little bit better. Also, you are experiencing some copious amounts of mucus that you are coughing up. It's really, really important that we do increase our fluid intake. So the rationale behind that is the more fluid that we are taking in, the more hydrated your body is, and it's going to help loosen up some of those secretions. It's going to help thin them out, so it's going to be easier to expel them. So can you tell me how to use this incentive spirometer? Perfect. And then what is one thing that is going to be really helpful in thinning out the secretions so it will be easier for you to cough up? Increase your water, yes, and fluid intake. Also, we want to get the mobility going in your intestines. So what happens is when you are laying in the bed, your mobility decreases, so it can cause constipation. So one of the things that we could do to help prevent that is to increase our our fiber intake. So can you name something that is really high in fiber? Vegetables, yes, perfect. Also on your medication chart, it says that you are on a low sodium diet. So this is really, really important to keep a low sodium diet. We want to keep it to about 2 grams a day. So it's really important when you are grocery shopping, or if your caregiver is grocery shopping for you, to have them read the labels on the back. And we do want to keep that to a 2-gram diet a day. So I know that you have been having trouble with incontinence. We did insert a Foley catheter, but that doesn't necessarily mean that it's going to take that away after. So one of the things that I like to talk about on this matter is toilet training. So it will be really helpful to kind of get you into a schedule of toileting, say every hour, every 2 hours. Even if you don't feel like you have to go, it's really important that you do go to the restroom and try. This is going to help train your bladder and get on a normal schedule, so we can be having less incontinence spells. Also, you are on a fall risk precaution, so I'm going to put this band on your wrist that says you are a fall risk precaution. And then also just remember that when you are getting